Hello, this is Melody McCune, and I'm going to talk to you guys today about health policy analysis and how school suspensions affect children and also how it relates to the General Statute 138-440.1, which is the requirement of the health assessment form for all children entering North Carolina schools. The problem statement for this issue is why do parents not get their children's school health assessments completed and what are the effects of the children being suspended? There are many different variables that affect this issue. Number one variable is, does this current health assessment policy protect the vulnerable populations? These populations could include people living in poverty, people with transportation issues, parents or guardians that have mental health issues, and many more. The second variable is, does the current policy encourage suspension from school? And the third variable is, do available resources meet the needs? Are there enough medical providers in the community to perform these health assessments in a timely manner? And is there access for children who don't have insurance to get these health assessment forms completed? There are two general statutes I'm going to discuss today in North Carolina. The first one is Chapter 138-440.1. This one relates and states that every child in North Carolina entering public schools shall receive a health assessment within 12 months prior to the date of school entry. The second is General Statute 110-867, which requires that any child presenting to public schools in North Carolina must present an up-to-date certificate of immunizations. For both the immunization and the health assessment, the medical provider or parent or guardian must present a completed health assessment form or immunization certificate to the principal of the school on or before the child's first day of attendance. If the health assessment or vaccine record is not presented on or before the first day of school, the principal shall present a notice of delinquency to the parent or guardian. The parent or guardian will then have 30 days from the first day of attendance to present the required health assessment form and/or immunization form. At the end of that 30-day notice, the child will be expelled from school if the health assessment or vaccine record is not completed and turned into the school. On this slide, I'm going to talk a little bit about the background of this issue. Until school year 2016-2017, the need for completed health assessment form only applied to students entering kindergarten. However, in that year, the regulation was expanded to include all students that are new to North Carolina public schools, regardless of the grade level. The health assessment is a very important form because it ensures that the school is aware of any medical or developmental concerns that can impact a child's well-being and their ability to learn and thrive in the school setting. School absenteeism is linked with poor student performance even in the early grades, which minimizing the number of days a student is absent from school is paramount. Missed days means missed learning, leading to lower test scores and reduced likelihood of graduating from high school. There is a lack of community awareness and understanding of the required health-related documentation that is needed for students to attend school. This can be the parents' misunderstanding or even the medical providers at times misunderstanding of this new statute. Effective management of students at risk for being kept out of school is challenged by the variations in school protocols for processing the health assessment forms. Data collection and management systems to keep record of students who were in danger of exclusions is not a standardized process between schools or school nurses. Some families face multiple barriers to come into compliance, like poverty, insurance status, mental health issues, inability to obtain a medical appointment in a timely manner, and language barriers. This graph on this slide shows the number of children that were not in compliance with required documentation within the 30-day start of school, and goes back to year 2013 to 2014 up to 2016-2017. And you can see it in Forsyth County alone, there were 244 children that did not meet the required documentation of either the health assessment form or the vaccination requirements. This is an alarming number because, as I stated before, if children miss school, that's missed learning opportunities and leads to poorer outcomes. There is a direct correlation between the cycle of poverty and lack of education. Children that are living in poverty often have a lack of opportunity due to the lack of education that they receive due to high absenteeism rates, due to multiple reasons. They're also likely to have lower incomes in the future and be dealing with issues at home like hunger, poor health, and poor living conditions. It's important that we look at health policies to address these issues so that we can help these children be successful. There are many important key stakeholders that are involved in addressing this issue of children being suspended from school and missing days and missing work. Some of those include parents or guardians and families, the children, the teachers, school administrators, school staff, school nurses, social workers, and local medical providers. There are many key factors that play into this issue. First one of those is the political factors, such as local legislators and the public being very interested in keeping kids in schools. There's reason to act now to keep these kids in schools because research shows that kids in schools are more successful and more likely to graduate high school. There are also social factors such as children living in poverty, non-English speaking, children that have transportation issues, or parents with mental health issues. There are economic impacts to children missing school too, because if children miss school, they're less likely to have higher incomes and has a higher economic impact because they're more likely to be on governmental assistance in the future. There are practical implications such as if schools, medical providers, parents, and community agencies collaborate, there is hope to improve this issue, and it will take a team approach to solve this. Their legal restrictions behind this are the GS 138-440.1, which requires schools to suspend students who don't comply. There are also quality of care issues, such as evidence shows that keeping kids in school improves quality of life, improves student success, and makes them more likely to graduate. There are many options that we can consider. One of those first options is to have school nurses collaborate with local resources to reduce the number of exclusions from school for students related to noncompliance with health assessments. There are Community Care Partners of North Carolina and CC4C programs, which is Care Coordination for Children. These are care managers that can help get these health assessments completed so that children are not excluded from school. We can develop a standardized system of form intake, data collection, and management in order to efficiently and accurately identify children with gaps in compliance early enough to provide targeted interventions within the deadline. We could also create an expanded community-wide marketing campaign that will target the parents and target medical providers so they're all aware of this new requirement for the year 2016-2017 so that people are aware and can make sure they meet the deadlines. We can help to establish a transportation fund for families with transportation issues. This would help those families who don't have a way to get back and forth to the doctor's office have money to get to the doctor, and then that way they get the health assessments completed and they can return to school in a timely manner if they've been suspended, or hopefully we can prevent that and get the physical completed within the 30-day time frame. And we could also fund and establish more school-based health centers and staff with providers who can perform the health assessments. Because if there are people within the schools that can perform these, then you can really make a difference and cut down on the number of children that are suspended due to lack of having this physical. The recommendations that I would make for this issue is to have schools work with the local medical providers closely to educate them on the health assessment requirement, and also work with the schools and help them partner with Community Care of North Carolina networks to address the reason why children don't get the health assessments, such as poverty, transportation, mental health, lack of education, language barriers. They can help link these patients to resources and help them get what they need to be able to get to the doctor and get these health assessment forms complete. This slide relates to the Doctor of Nursing Practice Essentials. The DNP Essentials can help with this issue. The first one I want to talk about is the DNP Essential 5, which calls for DNPs to be an advocate for healthcare policy. It'd be important for DNPs to reach out to local and national legislators to support school-based health centers that are properly staffed with providers to perform health assessments, and also to be an advocate for these children and help enact or revise policies that will help these children stay in school and receive the health assessments in a timely manner. DNP Essential 6 relates to interprofessional collaboration for improving patient and population health outcomes. This is a very important essential because as we address this issue, schools need to work very closely with local medical providers to increase their understanding of the health assessment requirements, and partnerships with multiple community agencies should be formed to address this issue. I hope that you enjoyed my presentations. If you have questions, please let me know. This last slide includes the references that were utilized to form this presentation. Thank you and have a great day.